So whenever we think about hair loss, baldness, we always think about male pattern hair loss, hormonal hair loss, pattern familial genetic hair loss. But there are so many other causes of hair loss beyond this most common variety. And today we will be talking about another common hair loss which affects people across ages, from 2-year-old to 80-year-old, male or female. Anyone can get affected by this, and it's called alopecia areata. So if you know someone who is suffering from patches of baldness on the head, suffering from alopecia areata, then this video is for you. Hello everyone, my name is Dr. Gaurang Krishna, and today we'll be deep diving into a common cause of hair loss called alopecia areata. In this video, we'll be discussing about the causes, risk factors, symptoms, investigations, and the latest treatment options of this common hair loss problem. So stay tuned and let's start. So before we go into the specifics of this problem, we need to understand what exactly alopecia areata is. See, alopecia in general is any kind of hair loss. Any kind of hair loss is termed alopecia. Alopecia areata is a specific hair loss problem where a patient has patches of baldness on the scalp, on the beard, or any part of the body. There are various variants. Patch type alopecia areata, which is the most common type, alopecia areata totalis, where the entire scalp hair is gone, and alopecia areata universalis, where every body hair is gone. So there are various types of alopecia areata. Now, alopecia areata is primarily an autoimmune problem, which means that your own body's immunity cells are fighting against your hair follicles. Autoimmunity. The cause is unknown. There is no specific cause that, okay, you did this wrong, or this was the vitamin deficiency, or you took the wrong medicine and it had it. It's a matter of chance. It can happen to anyone and usually happens in the first 40 years of life. But it can affect across ages, 2 years old to 80-year-olds. Anybody can have this problem. It can come suddenly. Many a times the patient is not aware of the patches, and suddenly when he or she goes for a haircut, the barber notices that there is a patch. It can develop overnight also. So patch type of baldness on the scalp without a hormonal cause is most of the times alopecia areata. So the cause is unknown. What we understand is that it is happening because of autoimmunity, but there are certain risk factors. So patients who have an affected family member, it's running in the family, are more prone towards developing alopecia areata than a normal individual. Also, people who have diabetes, thyroid, or other autoimmune problems are also at risk to develop alopecia areata. Stress is considered as one of the most common triggering factors. I don't mean to say that everybody who has stress will develop alopecia areata, but somebody who has a genetic predisposition and develops too much stress, then the chances of developing areata patches are fairly high. So these are the various risk factors for developing alopecia areata. So who's affected by alopecia areata? Alopecia areata does not differentiate. It can happen in children, it can happen in adults, young people, old people, it can happen in men, it can happen in women. So any human being can get affected by alopecia areata. It's a matter of chance. Genetics do play a role, as we have discussed, and in fact scientists have identified certain culprit genes. So there is a definite genetic predisposition in developing alopecia areata. Generally, if you see the general population, there is a 2% prevalence rate. That means out of 100 people that you see, 2 may have alopecia areata. Now the symptoms. See, the most common symptom of alopecia areata is a patch of complete hair loss, a coin-shaped patch of a complete hair loss on the scalp or on the beard. On the beard also it's very common. So any hair-bearing area having a coin-shaped patch of baldness is most of the times alopecia areata, and that's the most common symptom. Then there is a variant called alopecia areata incognito, wherein you do not have the patches, but there is a diffuse loss of hair, and that very it mimics the pattern, the normal patterned alopecia, and only a skilled dermatologist can differentiate the two. So the most common symptom is a clear-cut patch of baldness, and rarely it also presents itself as a diffuse hair loss. Most of the time there is no preceding lesion, there is no itching, there is no rash or redness before alopecia areata happens. It just happens, it just starts as a bald patch, and many times the patch remains constant. And sometimes the patch is fluctuating as well. That is, the hair regrows, then again goes, a new patch can develop. So it's a fluctuating problem most of the times. Now, how do we diagnose it? See, diagnosis is primarily clinical. The moment we look at the bald patch, we know what we are dealing with. It's clearly distinguishable on a clinical examination. Sometimes we do a thing called trichoscopy, where we examine the bald patch under a lot of magnification. We certain signs like yellow dots, exclamation hair mark sign. So basically, in the dermatologist office, without any special investigations, alopecia areata can be diagnosed. Very, very rarely we request for a skin biopsy. It's primarily done to differentiate between scarring alopecia, because sometimes alopecia areata, when it becomes very, very long lasting, it can masquerade scarring alopecia. So that's the only indication of doing a skin biopsy, and most of the time the diagnosis is clinical or through a simple magnified examination of the skin. Now coming to the part where most of you will be interested in is the treatment options. How do we treat alopecia areata? Well, no treatment is also a very good treatment, because we know that most of the alopecia areata patches, particularly if they are just one or two, a small patch, the hair regrows on itself anywhere between 3 to 6 months. So if you have a very small patch on not a very cosmetically important side, back of the scalp, lower part of the beard, then you should wait for 3 to 6 months, and the chances are that the hair will grow back itself. If it does not, you see a dermatologist. If a patient has multiple lesions or rapidly progressive lesions, then we want to actively treat. The treatment options basically are immunosuppressing medication like steroids, steroid sparing agents. So basically immunosuppressants or immunomodulators, these are the medicines that we use either in the cream form if the disease is limited, if the patches are limited, 2 or 3, not spreading, then we use local treatment, cream treatment. If the patch is on a cosmetically important site, for example, eyebrow, moustache, front of the scalp, then we want to treat it more actively, and we sometimes inject steroids into the lesion. These are called depot injections, do not have the steroidal side effects, because most of the time they do not go inside the blood if injected properly, and the results come in 3 to 4 months. These injections are usually repeated every 21 days. But this is not for self-medication. You must see a dermatologist for a proper treatment plan. When you are developing more than 5 lesions per month, the disease is spreading very fast, or a lesion is spreading, the size of a lesion is spreading very fast, then we give internal or systemic treatment, something that goes in your blood and acts from within. So there are medication like steroids, JAK inhibitors, etc., which are only under a dermatologist supervision, only are prescription medicines. They are given with proper blood tests, proper monitoring. So if your patches are developing very, very quickly, the disease is spreading very fast, then you should immediately see a dermatologist and go for a proper treatment. Extensive research is being done in this disease, and we are finding new molecules, new medications which have higher efficacy, lower side effect rate. So the treatment is changing. If you have patches, do not lose hope, because treatment options are definitely available. There are certain scenarios where I ask my patients not to treat it, and that is alopecia areata universalis. When you have lost all the body hair, then the treatment is very difficult and most of the times temporary. So there the options of using hair systems, hair patches, hair wigs, for eyebrows using microblading or tattooing, for eyelashes applying artificial eyelashes, these things are recommended rather than medical treatment. So there are certain scenarios where we as doctors and as your well-wishers advise against doing a medical treatment. One word of caution, hair transplant is not for alopecia areata. Many, these days, because hair transplant has become very popular, patients who have seen patches of bald scalp, they come to me requesting for a hair transplant. So for your information, alopecia areata is a complete contraindication for a hair transplant. You must not do a hair transplant on an alopecia areata patch, because the implanted hair can get affected by the disease, and you may lose even your transplanted hair. So for alopecia areata, it's only and only medical treatment, no surgical intervention. So folks, this was about alopecia areata. We thought of making this video because we are seeing more and more patients suffering from this disease. In fact, in many medical colleges, dermatology departments, whole theses are being done, whole projects, whole researches are being done in alopecia areata. It's a fairly common problem and it's treatable, it's manageable. If you know somebody who is suffering from alopecia areata, please forward this video to them and they will get a lot of information. If you yourself have any questions, please ask us and we'll be replying them one by one. Thank you so much.